Imagine a compound that in study after study helped torn tendons knit back together, calmed inflamed guts, and brought people relief when nothing else had. And it traces back to one of the most unexpected places in the human body, your stomach. Thousands of people swear it gave them their bodies back. The early human results are honestly surprising, and rigorous trials are finally underway. This is the story of BPC-157, what the science really shows, and the honest catch worth knowing. BPC stands for Body Protective Compound, and the story starts in the gut. Researchers studying human stomach fluid isolated a protective protein, and from it, they built a small synthetic peptide just 15 amino acids long. What made it remarkable right away was how tough it was. Most peptides fall apart in stomach acid. This one shrugged it off, staying stable for over a day. That durability is part of why scientists were so intrigued, and why so many people eventually wanted to try it. Here's why so many people are excited. The mechanism is genuinely elegant. BPC-157 seems to encourage angiogenesis, the body growing fresh blood vessels into injured tissue, flooding the area with oxygen and nutrients so it can rebuild. It appears to help fibroblasts, which are the cells that lay down new collagen. And it also calms inflammation in the gut. In animal models, it repaired tendons, muscle, and bone. And for a lot of people, that translated into something they could feel. Less pain, faster comebacks, getting back to the things they love. This isn't only a lab story, it's a story about people who felt stuck and found something that seemed to help. And this is the part the skeptics often skip. The human evidence, while early, is genuinely encouraging. In one pilot study, 12 women with severe bladder pain who had failed standard treatment received BPC-157. 10 of them had their symptoms completely resolve. In a review of chronic knee pain patients, nearly 9 in 10 reported meaningful relief. And a small intravenous safety study found no concerning changes to heart, liver, kidney, or other markers. These are small studies, yes, but the people in them weren't imagining their results. There's a real signal here, worth taking seriously. So why isn't it simply everywhere? A few honest reasons, and they're worth understanding rather than fearing. First, most of the strong proof is still early. These are small, uncontrolled studies, and the placebo effect is real, so we can't call it settled yet. But here's the genuinely good news. That's changing. A proper, randomized, double-blind, placebo-controlled trial is recruiting right now, testing BPC-157 on hamstring injuries, with MRI scans to measure real healing. That's exactly the rigorous test this peptide deserves. Now, there are also a couple of theoretical safety concerns worth knowing. Not to scare you, just so you have the full picture. The biggest one comes from that very same healing mechanism. Because BPC-157 encourages new blood vessel growth, researchers are unsure if BPC-157 could theoretically feed an existing or undiagnosed tumor. That's why it's generally considered off-limits for anyone with a history of cancer. And because there's so little human data, we also don't yet know how it interacts with common medications, or what long-term use really does. None of this means it's dangerous for everyone. It means the unknowns are real and worth respecting. One more honest point, because it isn't formally approved, a lot of what's sold online is unregulated, so purity and quality vary wildly. And that, more than the peptide itself, is where the real risk lives. And for competitive athletes, it's worth knowing it's currently banned in sport. So here's the honest, hopeful verdict. BPC-157 is one of the most genuinely promising recovery compounds we've seen. A stomach-derived peptide with an elegant mechanism, encouraging early human results, and a lot of real people who feel it changed things for them. It's not fully proven yet, and it deserves to be sourced and studied properly rather than gambled on through sketchy websites. But the science is finally catching up to the stories, and that's exciting. Follow for more.